Cancer is often diagnosed at a stage where it has already spread, making treatment more challenging. However, being aware of the early signs can significantly improve your chances of early detection and successful treatment. Here's a closer look at 8 early warning signs that your body might be trying to alert you to the presence of cancer. Pay attention to these signals and consult a healthcare professional if you notice anything unusual. 1. Unexplained weight loss. Imagine stepping on the scale and noticing a sudden drop in your weight without changing your diet or exercise routine. This isn't just about dropping a few pounds from a new workout regimen or skipping a meal. Significant, unexplained weight loss, particularly more than 10 pounds, can be a red flag. While weight loss can result from various factors, including stress or a change in lifestyle, when it occurs without any apparent reason, it might be a sign of cancer. In cancers like pancreatic or stomach cancer, the body may start to break down muscle and fat as it fights the disease. This can lead to dramatic weight loss, which can be one of the earliest signs that something is amiss. If you notice your clothes fitting differently or you're losing weight without trying, it's worth bringing this up with your doctor. 2. Persistent fatigue. Fatigue is a common symptom that almost everyone experiences from time to time. We all have days when we feel drained or run down, but what if that feeling doesn't go away, no matter how much you rest? Persistent fatigue that doesn't improve with sleep or rest could be more than just a sign of overwork. Cancer-related fatigue is different from typical tiredness. It's often described as an overwhelming, debilitating exhaustion that doesn't seem to be linked to any specific activity. For instance, if you find yourself feeling unusually tired after completing normal daily activities, this could be a sign that your body is dealing with something more serious. Persistent fatigue can be a symptom of several types of cancer, including leukemia and other blood cancers. 3. Unusual pain. Think about how your body feels after a long day. Muscles might ache, or you might have a headache. But what if the pain lingers or appears without a clear cause? Chronic or unexplained pain could be an early warning sign of cancer. For example, persistent back pain or headaches that don't respond to typical treatments might suggest that something more serious is at play. Pain that doesn't seem to fit with your daily activities or that worsens over time should be evaluated. Some cancers, like bone cancer or tumors, might present as unexplained or unusual pain, signaling that a deeper issue could be present. If your pain is ongoing and affecting your quality of life, it's important to seek medical advice. 4. Skin changes. Your skin is often one of the first places to show changes, and these can sometimes be a sign of cancer. This isn't just about the occasional pimple or age spot. Pay attention to any new or changing skin lesions, moles, or spots. Changes in the size, shape, or color of a mole, or the development of new growths can indicate skin cancer. Melanoma, a serious form of skin cancer, often starts as a new mole or changes in an existing mole. It's crucial to monitor your skin regularly and look for anything that seems different. If you notice a mole that is asymmetrical, has uneven borders, multiple colors, or is larger than a pencil eraser, it's worth getting it checked out by a dermatologist. 5. Persistent cough or hoarseness. A cough might seem like a minor inconvenience, but if it persists beyond a few weeks or worsens over time, it could be a cause for concern. Similarly, a hoarse voice that doesn't improve could be a sign of something more serious. Cancers of the lungs, throat, or larynx can present with these symptoms. If your cough is persistent, accompanied by blood, or associated with other symptoms like weight loss or fatigue, it's important to consult a healthcare provider. Persistent coughs or hoarseness are often linked to respiratory issues, but when these symptoms don't improve or seem unusual, they might warrant further investigation. 6. Changes in bowel or bladder habits. Your digestive system and urinary tract are integral parts of your body's functioning. Any significant changes in bowel or bladder habits can sometimes signal cancer. For instance, if you experience persistent diarrhea or constipation, or if you notice blood in your stool or urine, it could be a sign of cancer affecting the digestive or urinary systems. Colon cancer, for example, can lead to changes in bowel habits such as narrowing of the stool, persistent abdominal pain, or blood in the stool. Similarly, Bladder cancer might cause frequent urination, blood in the urine, or pain during urination. Monitoring these changes and discussing them with your doctor can help in early detection and treatment. 7. Difficulty swallowing. Imagine eating a meal and suddenly feeling like something is stuck in your throat or chest. Difficulty swallowing, or dysphagia, can be more than just a minor inconvenience. It can be an early sign of cancer affecting the esophagus, throat, or stomach. If you find that swallowing is consistently painful or difficult, or if you feel like food gets stuck in your throat, it's important to seek medical advice. This symptom might be related to conditions such as esophageal cancer or throat cancer, where tumors can obstruct or irritate the swallowing passage. 8. Unexplained bleeding or discharge. Bleeding or discharge from areas where it isn't expected can be alarming. This could include unexplained bleeding from the rectum, vagina, or any unusual discharge from the nipples or other areas. These symptoms can sometimes be associated with various types of cancer, including cancers of the reproductive organs or the digestive system. For example, vaginal bleeding between periods or after menopause can be a sign of cervical or endometrial cancer. Similarly, blood in the stool could indicate colorectal cancer. If you notice any unexplained bleeding or discharge, it's important to get it evaluated by a healthcare professional. Conclusion: our bodies are remarkably adept at signaling when something isn't quite right, but these signals can be subtle and easy to overlook. Being aware of these early signs and paying attention to any unusual changes in your health can make a significant difference. If you experience any of these symptoms persistently, don't hesitate to consult a healthcare provider. Early detection can lead to more effective treatments and better outcomes. Remember, while these signs may be caused by other, less serious conditions, it's always best to err on the side of caution and get a professional opinion.